kamighimo tolangit sikoy ko kamighimo taaldo ay bulan ikaw ang nagbuhat sa kabituunan ikaw ang nagbuhat sa kalibutan manama mawantog ka warag po ko iling koy ko o di simbahon ko
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم فقال ربكم ادعوني أستجب لكم آمين يا رب العالمين الحمد لله رب العالمين الرحمن الرحيم مالك يوم الدين إياك نعبد وإياك نستعين اهدنا الصراط المستقيم صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين آمين اللهم اجمع شمل المسلمين والكريستيان والأمة في مدينة دباو وسلم دائما مجتمعنا هذا بالسلم والأمن والتقدم في بلدنا هذا آمين يا رب العالمين ربنا لا تزغ قلوبنا بعد إذ هديتنا وهب لنا من لدنك رحمة إنك أنت الوهاب ربنا إنك أنت الوهاب ربنا آتنا في الدنيا حسنة وفي الآخرة حسنة وقنا عذاب النار وصلى الله على خير خلقه سيدنا محمد وعلى آله وصحبه وسلم سبحان ربك رب العزة عما يصفون وسلام على المرسلين والحمد لله رب العالمين آمين يا رب العالمين.
In the name of the Father, Son, and Holy Spirit. Amen. Our most gracious Heavenly Father, we come to you today to praise and worship you and give you thanks for all the things you continue to provide for ourselves and our families. Father, we humbly ask for forgiveness for all the times we have offended you, when we forget to acknowledge your presence in the image of our brothers and sisters, and for moments we fail to be good stewards of the blessings you have given us. Continue to guide and protect each one of us, Lord, that we may always walk in the light of your everlasting love and mercy. Grant us, Father, with your comfort in times of distress and with your strength in times of weakness. Bestow upon us your unending grace and healing, that we may in turn become instruments of gentleness and compassion to others. We ask all this in the name of your Son, our Lord Jesus Christ, with a prayer and the intercession of our Blessed Mother. Amen.
manama mawantog ka warag po ko iling koy ko o Diyos kahibulungan ka busa ikaw lang ang simbahon ko busa ikaw lang ang alagaran ko
Magandang hapon po sa inyong lahat. Kumusta kayo? Isang maulan na pagbati po mula dito sa Pasig City, sa Central Office ng Department of Education. Maraming salamat po sa mga nag-abang. Simula pa kaninang alas 4 na alam talaga nila na tuwing araw ng Martes, NDEP Webinar Series ang araw na yan. Pero naintindihan din po natin no, na marami sa atin ngayon ang merong mga technical issues pagdating sa connection. Tayo po mismo kanina, meron tayong mga troubleshoot sa iba nating mga makakasama sa webinar series na ito. So we understand kung yung ilan po sa inyo will rely na lang po sa recording. Available naman po ito sa ating DepEd learning management system for our professional development, yung PDLMS. So pwede nyong balikan doon, pwedeng ma-access doon ang mga quiz kung inyo pong kailangan ang inyong mga certificate of attendance, and syempre i-review yung mga previous episodes, pwede nyo pong balikan doon. So kumusta po? Kumusta ang huling linggo ng paghahanda natin para sa opening of classes? We understand that some of you, especially our dear teachers, nasa gitna ng pagdiriwang ng National Teachers Month, kayo rin ay abalang-abala para sa final preparations. Lahat naman tayo, no? Pero kayo at the front lines, we understand if you will need to take some time na balikan na lang itong broadcast na to. Meron din kami announcement later to give you enough time to really digest the learning na nakakuha po natin mula dito sa ating NDEP Webinar series. Ayan, so again, welcome po. Nandito na po tayo sa ating pang-apat na episode ng ating webinar series. Nakakatuwa ang inyo pong enthusiasm mula sa ating first episode noong September 8, no, na nag-open tayo about the school as a perfect setting for drug prevention. Isa sa mga favorite takeaways ko from Professor Duca, yung Pante, Prof. Grace, yung sinabi niya na very strategic yung place ng school for substance use prevention, pero at the same time, we need to be very careful kasi drug prevention can be harmful kung hindi tayo evidence-based. And that's the word that has been repeatedly resounding in all our webinar series episodes. Evidence-based ang bawat pagkilos, especially that we are talking about people's lives here, ay maganda na laging informed tayo ng evidence sa ating mga ginagawa. So ipatunayan natin that something that we thought of doing, especially concerning the lives of our learners and our personnel, ay evidence-based. And we are not left without guidance. So sabi doon sa ating second episode, kasama naman si Pastor LJ, meron tayong UNODC standards na pwedeng maging reference kung ano ba yung mga evidence-based interventions na pinag-uusapan natin. Last week, isa sa mga buhay na hapon sa buong Pilipinas, sa comment section hanggang dulo, ang ating mga viewers, kayo ay very tuned in to our speaker na gino through tayo sa DepEd as a workplace and workplace setting in terms of drug prevention. So kasama si Sir Santi, marami siyang mga pre-post na interventions, mga something to consider kapag gagawa tayo ng mga drug prevention initiatives. What I appreciate from that talk is that although at the start we talked about drug use as an issue, yung mga interventions did not have to be related to drugs. It's already about the person, no longer about the substance. So ang ganda ng mga naging discussion, especially natin sa Q&A, that this is about compassion for our colleagues, for our fellow workers in DepEd, na we are after the health and safety and well-being of each other. At sa ganong lens natin ina-approach itong drug use na issue. So related pa rin sa mga pinag-usapan natin sa first episodes, yung pag-uusapan natin sa fourth episode na ito. But I will not preempt you kasi i-introduce later ng ating kasama sa School Health Division kung sino yung magiging resource person natin. So I hope that you just sit back, relax, habang nagsisimula pa lang tayo, you can take a break from a while, tingin kayo sa malayo for 20 seconds para nare-rest niyo yung eyes niyo every 20 minutes. That's something that I read in preparation for this webinar. Alright, so let me just address some of your questions. Meron lang tayong ilang mga reminders bago tayo mag-start na habang nandito pa tayo on board. No? One of the frequently asked questions ay paano ang certificate, paano ang registration. Nasasagot po yung lahat ng yan sa memorandum natin na madadownload ninyo sa link na ito. So pwede ninyong tingnan yung link dito po sa inyong screen sa bit.ly/2020 NDEP Web Series. Yung memo natin, step by step, makikita po ninyo ano ang dapat gawin. And then you only need to register once. A frequently asked question, paano ang certificates? Yan, sagutin na rin natin ngayon pa lang. Actually, you only get a certificate of attendance per episode. So, bawat attendance po ninyo, bawat pag-view ninyo ng recording na ito, kailangan nyo lang matake yung exit quiz na nagiging available at 8 p.m. every Tuesday. Nandun lang naman yon sa ating PDLMS. pero you only have 2 attempts para masagot yung inyong, para ma-take yung quiz. So if you get 80%, mag-o-automatic na mag-generate yung ating system ng certificate of attendance. And then kapag nakumpleto ninyo yung 10 na episodes ng ating webinar series, pwede na kayong makakuha ng certificate of completion. So again, you just need to go back to the memorandum para masagot yung inyong mga questions. And all throughout our episode, maaaring meron kayong mga maisip na itanong o meron kayong maisip na comment. Maganda na pumunta lang kayo dito sa link na ito sa bit.ly 2020 NDEP Web Series Feedback and then raise your comment, your question, your insight. Hindi natin ina-encourage na sa comment section ng ating live video ilagay kasi natatabunan siya and sometimes people are getting in and then they are saying na we're watching from this city or that town. So dito po ninyo sa link na ito ilagay. Alright, so again, welcome to our 4th episode. Para sa mga bago pa lang na nanonood ng ating broadcast, we are now on the 4th episode of our 10-episode webinar series that will run until November. Pero may nakikita na kayong board dyan, no? Para sa mga, we understand that you're preparing for the opening of classes. Next week, gagawin po muna natin siyang rest day since it's the opening of classes and you have that entire time to review all the previous episodes, take the exit quiz kung di nyo pa nakakuha, and generate your certificates of attendance. Sige, hindi na natin po papatagalin. Meron akong konting activity para sa inyo. In the previous weeks, I've been asking you questions and then you type in the comments section. Ang gagawin po natin ngayon, fill in the blank, pero just answer it in your mind. No need to type in the comments section. Hindi nyo po kailangang sabihin loudly. Just think about this in your mind. Fill in the blank. Complete the sentence. A person who uses drugs, blank. What's the first phrase, word, sentence, even paragraph na pumasok po sa isip ninyo to complete this sentence? A person who uses drugs, blank. Sige, is it something positive? Is it something negative? Ito po ba ay something na naririnig ninyo frequently? Ito po ba ay something na paulit-ulit ninyong napanood sa TV? Ito po ba ay something na tinuro sa inyo growing up? So what is important is nasagot ninyo yan sa ngayon, pero babalikan natin kung ano yung nasagot ninyo when we go to our resource person later and listen to her lecture. Titingnan natin, ito bang paniniwala ko patungkol sa mga tao na gumagamit ng droga ay nakakatulong sa ating goal of having healthy and safe and well personnel and learners. Yan ang pag-uusapan po natin sa 4th episode na ito. Yan. So sige po, let's have our, as we mentioned in the past weeks, this activity is organized with the Dangerous Drugs Board, our authority when it comes to drug prevention and drug education in the Philippines, na lagi po nating nakaka-partner sa DepEd when it comes to our drug prevention efforts. So let us welcome to give us his weekly message at kasama po natin every week. Let us welcome our Executive Director of the Dangerous Drugs Board, Yusek Earl Saavedra.
Gian,
magandang Earl, good afternoon po.
Good afternoon. Good afternoon sa ating mga kasamahan. As what was mentioned, ito po yung ating weekly schedule ng webinar series on the National Drug Education Program. Siguro napansin ng ating mga kasamahan online, medyo nagbago po tayo ng lingkod na taga-Dangerous Drugs Board sapagkat isasalang po kami sa plenary ng House of Representatives para sa budget deliberation natin for 2021. So, dediretso na po ako sa aking sharing sa linggong ito. Kapag pinapalalim natin ang usapin tungkol sa drug abuse prevention and control, nakikita natin na bawat mamamayan ay may responsibilidad upang palaganapin ang tamang impormasyon at tulungan ang bawat komunidad upang wakasin ang problema sa iligal na droga. Simula nung inilunsad ng kasalukuyang pamahalaan ang pinaigting na anti-drug campaign, dalawang bagay ang nakikita natin na klarong mga layunin. Una, panagutin ang mga durugista, at pangalawa, tulungan at pagalingin ang mga nabiktima. Ito po ang sentro ng aking weekly sharing sa inyo ngayon habang dumadako tayo sa pangatlong linggo ng ating NDEP Webinar bilang pakikiisan natin sa kagawaran ng edukasyon. Our focus campaign has led to the surrender of more than 1 million drug users. Recognizing that communities are at the center of all our anti-drug efforts, we are employing a community-based approach to treatment and rehabilitation. Bakit po natin ginagawa ito? We believe that the most effective interventions are the ones that emanate from the community, carried out by the community, and for the community. So bawat isa sa atin dapat may sense of ownership tayo when it comes to this effort that we do. Through the establishment of community-based treatment and rehabilitation facilities, we are ensuring that treatment is available and accessible to those who need it the most. We are also improving the quality of treatment as we guarantee that the interventions provided are appropriate to the severity of the substance use disorder or conditions of the persons who use drugs. Sa mga interventions na ating ibinibigay, ipinapasok po natin ang stigma prevention and restoration of hope as part of the recovery process. Bakit po natin ito ginagawa? It is because we consider drug addiction not just as a security concern but also a health issue. Itinuturing po na sakit ang pagkakalulong ng isang tao sa bisyo ng paggamit ng iligal na droga. Nakakatuwa sapagkat ang usapin na ito kasama ng ating kaibigan at magaling na resource speaker na si Dr. Clara Fuderanan ng Department of Health ay magkakaroon ng malinaw na pangunawa sa hanay ng ating mga nakikinig patungkol sa mahalagang topic na ito. Remember this, encapsulating drug prevention and drug treatment as everyone's concern gives us the realization that we must keep on doing things right with urgency. Acknowledging the fact that we do not have forever to make things happen, we do what we can now. Ngayon po, in one common cause, we show that we are firm in our resolve to combat the challenges that hamper the progress of our country. We thank most of you for staying true to your duty to keep each and more progressive environment to live in. Let us always put to heart this renewed pledge as anti-drug advocates. Ngayon, para po sa ating virtual engagement na may papremyo, kasi pangalawang linggo ko na po ginagawa ito, inaanyayahan ko muli ang ating mga participants ng webinar ngayong linggo para tumungo sa Facebook page ng Dangerous Drugs Board. Just like last week, you share your thoughts on the important takeaway which I mentioned sa short sharing ko today. Just to recap po, ito yon. The most effective interventions are the ones that emanate from the community, carried out by the community, and for the community. Reflections submitted will give us the chance to select 2 active winners who will get cell phone prizes again from the Dangerous Drugs Board. Tandaan, since we are after of your undivided attention sa webinar na ito, do the submission of your entries after pagkatapos ng ating virtual session. So ipopost po namin sa Facebook page ng Dangerous Drugs Board yung infographic on the takeaway where you can comment your response. Ang mga sagot lang po doon ang aming babasahin. So I wish you all the best as you make this session worthwhile and productive. Muli, patuloy po nating hangarin ang mabuting kalusugan ng lahat sa pamamagitan ng ibayong pag-iingat. Magandang hapon po.
Maraming salamat po, Yusek Earl, and thank you for making your time sa gitna ng mga kabisihan din talaga natin ngayong budget period na ito. Thank you very much po for always making time for DepEd. We appreciate what you said, Yusek, na this is, we have efforts from the community on stigma prevention and restoration of hope. That we move from and to hope. Ang encouraging lang pong marinig nun. So, sa mga viewers natin na medyo na-late siguro ng pasok, si Yusek Earl has announced from the first time that he spoke in this in our episodes na meron silang prizes na cellphones sa mga nagpa-participate, sa mga nagbibigay ng reflections, and insights sa ating weekly episode. So for today, meron siyang binigay na instruction. Pupunta kayo after this broadcast, hindi ngayon. After this broadcast, you will go to the Dangerous Drugs Board Facebook page. You will see an infographic at meron dong statement where you will give your reflection base sa matututunan pa rin natin ngayon dito sa ating 4th episode ng ating NDEP Webinar series. Again, maraming salamat po, Yusek Earl, and the rest of our partners and colleagues and champions sa the Dangerous Drugs Board. Para naman pakinggan ang mensahe ng ating Chief sa Bureau of Learner Support Services School Health Division to be delivered by our Medical Officer 4, Dr. Marie Blanca Piatos. Let's welcome and let's hear the message of Dr. Maria Corazon Dumlao.
Maraming salamat, Gian. Muli magandang hapon sa ating masugid na taga-subaybay. I am so happy to meet again the avid viewers of these NDEP webinars. If you would recall, last time we talked about substance use prevention in the workplace. And I hope that everyone who watched or viewed the webinar last week really appreciated the role of the workplace in terms of substance use prevention. Today is another exciting and very learning experience topic because we will be talking about social stigma on substance abuse. Stigma can have a significant negative impact on a person's quality of life. It can affect the self-esteem and even the mental health and the relationships with others and the support services and resources that they can access to. We know for a fact that people who are stigmatized for their drug involvement can endure social rejection, labeling, stereotyping, and even discrimination. Substance use, which has often been viewed as a weak-willed and criminal behavior, has always been stigmatized. Our family, our friends, the general public can carry negative feelings about drug use or behavior. They can even use derogatory terms or label people as addict, salot, masamang tao, bad influence, and the like. Now, these thoughts, feelings, and labels can really cause and perpetuate stigma. Unfortunately, we have people who experience stigma regarding their drug use who are less likely to seek treatment. Not because it is expensive, but because they don't see the need to do so. Social stigma can lead to status loss, of course, discrimination, and exclusion from meaningful participation in the society. There are so many ways to address stigma, but being aware of the effects of stigma and working to recognize and deal with negative thoughts and feelings toward those who are addicted can lead to a more positive outcome for individuals and eventually the society. For today's webinar, we would like to understand the possible effects of stigma related to addiction and to know some strategies of counteracting the word stigma. Today also, we have another great speaker, an authority in her own right, with extensive knowledge and experience, who will discuss comprehensively the topic about stigma. She has been an active and supportive, partner of the Department of Education. So friends, let's make this afternoon a fruitful, productive, and a happy engagement with all of us. Again, magandang hapon po sa ating lahat. Thank you.
Thank you very much, Dr. Marie Blanca Piatos, for delivering the message of our Chief, Dr. Maria Corazon Dumlao. Ang ganda ng mga sinabi sa atin ni Dr. Dumlao through the message delivered by Dr. Piatos na this is really about relationships with people. So it might be extra challenging how to understand paano ba itong mga stigma na ito, pero we have an expert later guiding us through the process at mas maintindihan natin yung mga concepts na makakatulong pa sa ating drug prevention initiatives. So again, thank you very much po, Dr. Piatos, for that message. So katulad ng ginagawa natin every week, isinisituate natin yung ating NDEP Webinar series sa bigger program ng Department of Education na National Drug Education Program or NDEP. At ang NDEP ay bahagi naman ng mas malaki pang umbrella ng ating Oplan Kalusugan sa Department of Education or OK sa DepEd, ang convergence ng iba-ibang mga health and nutrition programs and initiatives. So ang inyong tanong, saan ba pumapasok itong NDEP Webinar Series? Meron pa bang ibang mga ginagawa ang DepEd patungkol sa drug education and drug prevention? Para i-walk through tayo para sa kung ano ba ang NDEP, at actually nagawa na po ito in the previous episodes, overview ng NDEP, and then yung activity last week na feature ay UPC. I-walk through ulit tayo sa isa pang initiative ng DepEd related to the National Drug Education Program. And para dyan, let's welcome our National Program Coordinator for NDEP. Let's welcome Ms. Girly Azurin. Ma'am Girly.
Thank you, Gian. Magandang hapon po muli sa inyong lahat. Well, last week napag-usapan po natin ang training on the Universal Prevention Curriculum for Substance Use or UPC. Well, we talk about the meaning, the 9 curricula of UPC Series 1, and the major accomplishments of DepEd in UPC. Okay? So ngayon po, isi-share namin sa inyo ang isa pang activity ng NDEP. Next slide, please. Well, we will briefly discuss. Okay. We will briefly discuss the training of the guidance counselors of the initial assessment and intervention for students, personnel found to be positive on drugs. Well, pinili po namin itong activity na to na i-share sa inyo because we are proud to inform you that this training was personally handled by an expert on this topic, none other than our speaker for today. So this training aims to define the whole screening, brief, intervention, and referral treatment process and its implementation in schools. Next, please. Next. Okay, ano po yung objectives natin dito? Explain, number 1 is explain drug addiction and how it affects the brain. So, kanina nabanggit po ni Yusek Earl that drug addiction is not just a social problem, but it is a health problem because it affects the brain. Second, utilize appropriate self-report screening tools. Naturuan po ang ating mga participants sa dalawang screening tools na CRAFT and ASIS. Well, ASIS stands for Alcohol, Smoking, and Substance Involvement Screening Test, and CRAFT means Car, Relax, Alone, Forget, Friends, and Trouble. So, based on the self-screening tools, ma-identify na po natin ang risk level of clients. And then conduct necessary brief intervention to clients based on the result of the screening process. Next, please. Another objective, demonstrate and employ motivational interviewing skills vis-a-vis the different stages of change. So dito po, nagkaroon po ng role-playing activity para sa interview ng ating mga clients. 6, formulate the necessary referral system for further assessment of clients. 7 is identify the possible resources, services available within area through networking and linkaging. And number 8, appreciate the importance of observing privacy, confidentiality, and documenting data gathered. Next, please. Next. So meron po tayong 4 na batches na ginawa dito sa training na ito. So ang nagkaroon po tayo ng first batch sa Region 2 and CAR. second batch sa Region 4A, third NCR. Ang last batch po natin ay TOT na po ito na ang participants ay representatives from the 17 regions. This was done in 2018. Next, please. Next. Gusto lang namin i-share yung mga photos namin on the TOT. Yung first photo po, okay, these are the photos po ng ating TOT. So, back slide. Previous slide, please. Okay, makikita po natin ang ating upper portion. Nag-lecture po ang ating resource speaker. Yung lower portion po ng photos, makikita niyo yung role-playing nila sa interview sa ating mga client. Next, please. Next, please. Ito po yung mga group activities ng ating regional participants. Next, please. Next. At ito naman po yung presentation ng kanilang outputs. Next. Ito po ang ating participants from the 17 regions dito sa training ng guidance counselors. Next, I think that's my last slide. Maraming salamat po. Till next episode po para sa another activity ng NDEP. Maraming salamat po.
Thank you very much po, Ma'am Girly. Maraming salamat sa pagpapakilala sa isa sa mga activities ng NDEP. Every episode po natin, we will introduce you to different activities under the National Drug Education Program para mas ma-familiarize po kayo and makita ninyo saan natin magagamit itong mga natututunan natin na ito sa bawat episode. Ayan, so katulad po ng ating sinabi kanina, tayo po ay nasa pang-apat na episode na sa 10-episode series na ito. We started with our first episode that talks about the school as a setting for drug prevention. Sabi natin, it's very strategic that we start with understanding how the schools can be instrumental in this initiative. And then para po sa ating second episode, we talk about the UNODC standards where we said na kailangan evidence-based and we are not left without guidance. Meron tayong mga standards that can guide us in doing drug prevention initiatives. And then last week, we talked about workplace setting in drug prevention. At dyan naman natin pinag-usapan kung paano tayo makakatulong sa ating mga colleagues or makaka-journey with our colleagues who may be using drugs or those who are not yet but are at the risk of doing so, and what interventions we can do para mag-flourish yung relationships natin with each other, and in that way, mas maging healthy yung mga choices natin in our lives. And this time, I think this is a very important topic. So again, para sa ating mga nanonood and bago pa lang sumasama, we are now in the fourth broadcast, in the fourth episode of our series. So, I like what we mentioned last time. Kung meron man po sa inyo na may mga questions related to what we are discussing this afternoon, feel free to type them in the link na shinare ko po sa inyo. Ayan, so katulad po nung pinakita ko sa inyo kanina, ito po, bit.ly 2020 NDEP Web Series feedback. So if you have questions, comments, insights that you need to share, dyan nyo lamang po ita-type. We do not encourage you to type in the comment section kasi hindi po natin sila makikita. We will try our best to answer your questions and ipakita po and i-erase yan sa ating resource persons. But sometimes you don't have enough time for Q&A. Tinitingnan po natin kung meron dyang mga tinatanong kayo na hindi pa nasasagot sa rest of the broadcast. So to introduce our resource person, let me call again our medical officer, Dr. Mariblanca Piatos.
Thank you, Gian. Magandang hapon once again. Allow me to introduce our resource speaker. Our resource speaker is a lady with a lot of achievements in her career. She is a psychiatrist, an addiction specialist, a life coach, lecturer, speaker, author, and researcher on various issues related to addiction medicine, psychiatry, and pharmacology. As an addiction specialist, she is responsible for the evaluation, assessment, management, and rehabilitation of patients with substance or behavioral addiction. She gives seminars and lectures on addiction causes, assessment, and management. She also attends court hearings as an expert witness in drug cases. As a life coach, she gives counseling and provides psychotherapy for clients to guide them in handling cases in different stages, phases, and challenges in their different roles in their lives, such as spouses, as a parent, as a child, a sibling, an adolescent, an employer, and an employee, and as a retiree. She is also a parenting counselor. She provides parenting seminars and workshops to schools, teachers, parents, as well as counseling to parents with difficulty in handling their children. Our speaker is also a member of the following medical associations. She is presently, she was the president in 2018 to 19 of the Philippine College of Psychopharmacology. And in 2016 to 2017, she was the vice president of the Philippine College of Pharmacology. In 2014 to 2015, she was the Philippine College of Pharmacology Board Secretary. And in 2013 to 2015, she was the vice president of the Philippine College of Addiction Medicine. In 2012 to 2013, she was the board secretary, the board treasurer of the Philippine College of Pharmacology. In 2010 to 2013, the board secretary of the Philippine College of Addiction Medicine. She is also an associate member of the Philippine Society of Geriatric Medicine, a regular member of the Philippine Medical Association Quezon City chapter, and a member of the Group of Addiction Psychiatry in the Philippines, a member. Now, our speaker is doing the webinar in her private capacity as an addiction specialist and psychiatrist. This is part of her advocacy, despite her busy schedule as a unit head of the Health Systems Development and Management Support Unit of the Dangerous Drugs Abuse Prevention and Treatment Program of the Department of Health. We are very lucky indeed and very thankful because she is here with us to support our NDEP series and to speak to us on her specialty, which is on social stigma. Ladies and gentlemen, and my dear friends, help me welcome Dr. Clara Hidalgo Fuderanan.
Good morning, good afternoon, everyone. I hope you're hearing me loud and clear. Am I coming to you loud and clear?
Yes, Doc.
Jian, can you hear me?
Yes, Doc, we can hear you.
Yeah, good afternoon, everyone. I'm happy to be here and to discuss on a very, very exciting topic with regards to substance use disorder. I will be talking about social stigma and addiction. Oh my, shaming the persons who use drugs. Next slide, please. So, what is stigma? Stigma is defined as a set of negative beliefs that a group or society holds about a topic or group of people. So, underline the negative beliefs. And also, on a topic or group of people. It's an attribute of an individual that is deeply discrediting. It's a severe social disapproval of personal characteristics or beliefs that are against cultural norms. And stigma daw occurs when elements of labeling, separation, stereotyping, status loss, and discrimination occur together in a power situation that allows them. Next slide, please. Actually, there are twofold impact of stigma. We are going to talk about stigma on addiction. Its twofold impact is public stigma and self-stigma. What is public stigma? Actually, public stigma is also known as the social stigma, wherein it is the reaction that the general population has to people with substance use problem. Ito po ang reaksyon ng ibang tao sa isang taong nagkakaroon ng problema sa paggamit ng droga. Next slide, please. Self-stigma, on the other hand, is the prejudice which people with substance use problems turn against themselves. So, yung public or social stigma po, yun po yung reaksyon ng ibang tao sa isang may problema sa pagdodroga. Pero ang self-stigma, yun po ang prejudice ng tao mismong gumagamit o nagkakaroon ng problema sa pagdodroga. Both of this, the public or social stigma and the self-stigma, may be understood in terms of three components. What are they? One is stereotype, two is prejudice, and the third is discrimination. We will be discussing this one by one. Next slide, please. So, in public stigma, ulit, ano yung public stigma? Yun yung reaksyon ng general population sa isang tao na nagkakaroon ng problema sa paggamit ng droga. So, ano naman ang stereotype? Ang stereotype is the negative belief about a group. In what we are going to discuss today, it's about persons who use drugs. So, anong stereotype ba ng general population para sa isang taong gumagamit ng droga? Ang negative belief po, ang isa sa mga negative beliefs about the persons who use drugs ay, nako, dangerous sila. So, kung dangerous sila, ito yung belief. Ano naman yung prejudice? Ang prejudice naman po sa kanila ay, ang ibig sabihin nito ay, yung dahil dun sa belief na yon, ano naman ang emotional reaction ng tao dahil ito ang paniniwala nila tungkol sa isang taong gumagamit ng droga. So, sabi natin, ang stereotype ng isang gumagamit ng droga ay dangerous. Anong prejudice? Dahil naniniwala tayo na sila ay dangerous, ang emotional reaction natin ay, syempre, takot. Kasi dangerous sila eh. So there is fear as prejudice. Ano naman ang discrimination? Dahil naniniwala tayo, ang isang person who use drugs ay dangerous, dahil yun ang stereotype sa kanila, ano ang prejudice natin o emotional reaction natin sa kanila? Nakakatakot. So ano naman ang magiging behavioral response natin sa kanila because of this? Dahil sila ay dangerous, tayo ay natatakot, therefore, ang reaction natin, behavioral response natin ay, i-avoid natin sila. Kasi nakakatakot sila eh. So ito po yung public stigma. Nakikita niyo epekto? Meron tayong negative belief na sila ay dangerous. Meron tayong emotional reaction dahil sila ay dangerous. We have fear. Dahil nakakatakot sila because they're dangerous, what is our behavioral response? We avoid them. So, nakikita niyo po siguro ngayon. So dahil dito sa stereotype na to, meron tayong mga corresponding prejudice at discrimination. Next slide, please. Next slide, please. Sa self-stigma naman, di ba sabi po natin, ang self-stigma ay yung namang, yung kanilang reaksyon sa sarili nila dahil sila ay gumagamit at may problema sa paggamit sa droga. So, ang stereotype, ang negative belief nila sa kanilang sarili ay, nako, wala akong kwentang tao. Incompetent ako. That's the negative belief. Kasi yun ang stereotype na nalalaman nila at naririnig nila sa kanilang paligid. Dahil ako'y gumagamit ng droga, ako ay weak ang karakter ko at napaka-incompetent ko. Dahil because of this stereotype, ang prejudice natin o ang ating emotional reaction dahil incompetent, ang reaction po ng taong yun sa sarili niya ay, ano emotional reaction? Siyempre, mababa ang tingin niya sa sarili niya. Kasi nga, nasa isip niya, ay incompetent ako eh. Weak ako. And therefore, wala akong dapat ipagmayabang sa sarili ko. And therefore, I feel na wala akong kwenta. So, there is low self-esteem. At dahil doon, ano naman ang behavioral response ng taong yun? Well, because of the prejudice, na may low self-esteem siya, because of the stereotype na weak siya, then nagpipil na po ang isang tao to pursue work. Wala na po siyang lakas ng loob na mag-pursue ng work. Kasi ang tingin niya sarili niya, hindi ko kaya. Wala na akong kaya. Walang kwenta kasi ko eh. And therefore, wala na ako ma-achieve. So, because of that, he feels very low para sa sarili niya. Next slide, please. And what will happen? Of course, malulumo siya, di ba? Siyempre, nadidepress siya. Yun ang nagiging problema. Because of the stigma, either the public stigma or the self-stigma, may stereotyping na nangyayari, mayroong belief na nangyayari na negatibo, meron tayong prejudice na nagkakaroon tayong emotional reaction because of that stereotype, and meron na ding discrimination. Next slide, please. So how do we promote stigma on addiction? For people with SUD or substance use disorder, sorry for that, wala yung an, stigma may stem from antiquated and inaccurate beliefs that addiction is a moral failing. Sabi nila, dahil may belief noong araw na kapag ikaw ay na-involve sa addiction o sa droga, no, ikaw ay masama. Okay? May moral failing ka. May character weakness ka. Instead of what we know it to be, that actually, substance use disorder or drug dependency is a chronic treatable disease from which patients can actually recover from. At kapag naka-recover sila, they can continue to lead healthy lives. Next slide, please. Addiction, identity, and morality. Presumably, addiction and drug use are more likely to be seen as morally bad when the period or the person who used drugs appears capable of having done otherwise, as opposed to being forced by external pressures such as poverty. Kung ang pinag-iisipan natin na ang addiction o yung pagkakalulong sa isang droga ay dahil masama ang isang tao o dahil ginusto niya yan eh. Okay? magkakaroon talaga tayong ng negative, no, na reaksyon sa isang tao na nai-involve po sa isang problema sa droga. The weakness of will model holds that addiction is blameworthy matter, na dapat lang silang sisihin kasi ginusto nila yon. Okay? Actually, the brain disease model saying that substance use disorder is a brain disease, it holds that addiction entails a relatively faultless loss of agency. Insofar as P-words becoming addicted to drugs may lead to a perception na sila ay nagbabago, different person sila. How many times have you heard of people describing somebody who is very near to them, who is close to them, ang sinasabing, naku, hindi ko na siya kilala. Iba na siya, ibang tao na siya, kakaiba na siya. At pag tinanong mo kung bakit, anong sasabihin niya? Gumanda ba siya? Gumaling ba siya? Naging productive ba siya? Hindi. Ang sasabihin nun ay, kasi dati doktora, tahimik yan. Dati doktora, nagtatrabaho yan ng maayos. Dati doktora, may respeto yan. So, ang parating pinag-iisipan na, kapag na-involve ka sa drugs, ginusto mo yan, mababa, mahina ka, very weak ang karakter mo, at saka masama ka na. These are the things that we try to stereotype persons who use drugs. Next slide, please. And therefore, it becomes the blame game. Puro blaming na lang. Blame mo siya kasi addict siya. Next slide, please. In fact, psychology and addiction, viewing addiction as a chronic condition may also suggest something continuous and persistent. Other studies found, actually, that when participants were given biogenetic explanation, ibig sabihin, dahil nasa genes na yan, or endorse it as a brain disease explanation as causal, individuals with substance use problems ay piniperceive as dangerous, having lack of self-control, unpredictable, and deemed less responsible for their action. So makikita po natin, kung in-explain naman natin na isa'y nasa genes yan, namamana yan, o kaya isa brain disease, hindi niya kontrolado kung ano nang ginagawa niya. Naku, edi ibig sabihin talagang dangerous siya. So be careful, no? Sasabihin niyo siguro, what happens then? Ano nang gagawin ko? Pag in-explain ko sa kanya na ginusto niya yan, mali. Pag in-explain ko na brain disease yan, meron pa rin problema. So these perceptions have far-reaching consequences for stigma and identity insofar as they relate to our assessments of the value of others. So lahat, kapag gumagamit ng droga, person who use drugs, puro blame. Blame him, blame her, blame mo siya. Next slide, please. So ano naman nagiging epekto ng stigma on addiction? Well, social stigma often leads to status loss, discrimination, and exclusion from meaningful participation in society. Nako, huwag na natin isali yan. Addict yan eh. Bakit natin sasali? Panggulo lang yan. Nako, dati naggumamit yan. Baka mamaya bumalik na naman yan sa pagdodroga niya. Nako, huwag na natin isali yan. And stigma can interfere with effective treatment. Why? A person who sees that addiction is stigmatized may feel shame and be reluctant to seek treatment. Kasi nahihiya siya eh. Dahil alam niya na negatibo at may stigma na ang isang gumagamit ng droga o gumamit ng droga kahit huminto na siya ay iba ang trato sa kanya kapag siya ay pumunta at manghingi ng treatment. Mababa ang tingin sa kanya bigla. Social supports for recovery may not be adequate in a community that stigmatizes addiction. For example, sa isang local government unit na hindi nagsusuporta sa isang tao na nalulong sa droga, hindi po niya gagawing priority ang programa for our persons who use drugs. Kasi ang usual na naririnig mo sa kanila ay, ba't ko pag-aaksaya ng budget ko yan? Eh, ginusto niya yan eh. Ba't ko pag-aaksaya ng budget ko yan? Eh, babalik din niya sa pagdodroga. Huwag na yan. Ibang project na lang. Gawa na lang tayo ng project for diabetics. Marami pa tayong matutulungan. Hindi mapuputulan ng paa. Okay. Wag na lang tayong gumawa ng mga projects for for persons who use drugs. Ang gawin na lang natin, budget para sa mga hypertensive. Dami tayong matutuwa sa atin yan. You see, if a local government executive does not support programs for for persons who use drugs, then lalo pong walang treatment that would be available for them. Also, an effect of stigma would be to discourage them from adopting healthy behaviors kasi masama na nga ang tingin sa kanila, very low self-esteem na rin ang tingin nila sa sarili nila. Therefore, what is there for them to live a healthy life or adopt healthy behavior? And therefore, stigma negatively affects recovery rates. Kahit nag-uumpi na sana siyang huminto sa paggamit ng droga, he's trying to recover from the substance use disorder. Kung naman nararamdaman niya and the society or the population does not look at him as somebody who could still come out from the problem and still heal and lead productive life without drugs, then bakit pa siya magpupursige? Another thing is the stress of hiding a substance use disorder, either out of shame dahil nahihiya siya, hindi na lang siya magsasabi na kailangan niya ng tulong, or to avoid stigmatizing responses from others can cause other medical and social problems. Alam niyo po, marami po akong nagiging pasyente na ganyan eh. Na pag natanong mo, sasabihin nila, maikukwento nila sa inyo eh, na alam nyo, mas hindi nawawala sa isip ko nung ako'y nagdodroga pa at nagtatry na magbago. Yung shame na nararamdaman ko nung pumunta po ako at nagtry akong maghingi ng tulong. Yun po yung hanggang ngayon nararamdaman ko pa. Yung paano nila ako trinato dahil alam nila na durugista ako. So, napakagrabe ang effect talaga ng stigma sa addiction. Next slide, please. It can also lead to self-fulfilling predictions that those who are addicted cannot recover anymore. So, naniniwala na tuloy sila dun sa stereotype na ibinibigay sa kanila ng ibang tao na wala na silang kayang gawin pa. Hindi na sila pwedeng maging positibo. And it can also lead to discrimination. Example, yung mga employers would not want to hire anyone who is in recovery, who are trying to recover from drug dependency. Kasi, ang stigma dyan is, nandun na sa kanila yan, tapos sinasabi nila, once an addict, always an addict. So, kawawa naman talaga sila. So, parang down the drain na agad sila because of the stigma. And so, this stigma can lead to what? Feelings of hopelessness and reluctance to seek help. Next slide, please. Next slide, please. How does stigma affect people? Violation of human rights. Example, they are being treated with less consideration and respect when seeking medical care and housing. No? Less consideration. Sa kanya yan, ako, adik naman yan eh. Ito muna si Aling Basyang ang unahin, bigyan ng ng medical na na assistance. Lack of employment, losing jobs and difficulty getting jobs if substance use problems are known. So kahit na try nilang magbagong buhay, pag nalaman na sila'y nagkaroon ng problema sa paggamit ng droga before, nako, minsan ginagawang pa ng storya just to get rid of the person in their workplace. And of course, the negative feelings of the persons who use drugs about themselves because they internalize those negative beliefs of others. Kung ano yung sinasabi ng iba na negatibo, parang ini-internalize na nila. And there are an effect also would be avoiding services. Bakit? Natatak nga sila eh na ma-face sila ng mga treatment ng tao for which they seek help na walang respeto sa kanila. And therefore, there is continued substance use to cope with these negative feelings. Parang magiging vicious cycle yan. Kasi there will always be those feeling of loneliness, there's those feeling of isolation and shame. And therefore, anong gagawin nila? Droga uli para mawala itong pakiramdam na ito at makalimot sila. And it becomes a vicious cycle. Next slide, please. So, are there strategies for changing the public stigma on addiction? Pwede pa ba nating mapalitan ito? Paano? Ano mga strategies? These are evidence strategies for public stigma. They are grouped into 3 approaches. 1 is protesta. 2 is education. At pangatlo po ay contact. Let's go through them one by one. What is a protest? So groups protest inaccurate and hostile representation of addiction as a way to challenge the stigmas they represent. So mga protesta, no? Pinoprotesta nila yung stigma na kinakabit nila sa isang taong nagkakaroon ng problema sa droga. Remember, a protest is always being heard of, no? Recently, meron pong protest sa mga NBA players. Nakikita niyo yung kanilang mga jerseys. Iba na, imbis na pangalan nila yung nasa likod, ano nakalagay? Black Lives Matter. Di po ba? That's one form of protest. Kasi may stigma sila for black daw. So, this protest, these efforts can send 2 messages actually. Protest to the media and tell them to stop reporting inaccurate representation of addiction. Tulad ng pag-represent nila sa media ng isang tao na nalulung sa droga ay okay, mabaho, madumi, okay, payat, mahirap, gulo-gulo ang buhok, walang trabaho. So, yun ang pinarepresent nila. Wherein, hindi po totoo yan. Hindi lahat po na nagkaroon ng problema sa droga ay mabaho, ay walang trabaho, ay mahirap. Hindi po lahat. At to the public to stop believing negative views about addiction. So, protestahan naman po natin yung mga stigma na ikinakabit sa kanila. Next slide, please. Education, wherein kayo po sa DepEd ay malaki ang pwede niyo pong maging role dito. Education. Education provides information so that the public can make more informed decisions about substance use problems. The strategic provisions of information about substance use problem seems to lessen the negative stereotypes associated with addiction, and participation in education programs led to improved attitude about persons with these problems. You have to highlight the reasons why people develop problems with substance use. Bakit nga ba sila nagkakaroon ng problema sa paggamit ng droga? Paano ba silang naging ganito? Ano ba yung mga causes nito? address media biases and inaccuracies, and portray people with substance use problem as human beings. Hindi yung pag nag-portray tayo or pag nag-educate tayo ng mga bata regarding persons who use drugs, puro negatibo. Alam naman natin na pangit na magkaroon ng problema sa substance use disorder as a substance use, pero wag po nating isama sa pag-educate natin sa mga bata na ang mga taong ito ay nagkaroon ng gantong problema dahil sa mga nangyari sa kanilang buhay. Dahil sa mga sitwasyon sa buhay nila na pinagdaanan nila. Dahil sa mga bagay-bagay na kung tutuusin ay kung nangyari sa'yo, hindi mo rin kakayaning sagutin na pwede kong papaglabanan yan. Kaya kong mapaglabanan yan. Because if you were in that situation, baka po kayo rin mas masahol po ang maging reaksyon ninyo. So parati when we educate people, you don't just say ang pangit tungkol sa isang mga tao na nagkaroon ng problema sa droga. But let them know, educate them on the causes, on the effect, on the empathy that we need to show them to be able to let them what? Be more supportive, be more caring for them, and be more patient with them so that they will be able to learn how to empathize with them and become positive, no, vectors or positive become positive, have a positive effect on the lives of people close to them or people they know who might be having some problem with drug use. Next slide, please. Contact. Ano ba yung contact? Stigma is further diminished when members of the general public meet persons with substance use problems. Okay? Show the positive ways of people with substance use problems rather than the negative. Example, ways in which individuals contribute to society. So, ipakita rin po natin sa kanila at i-highlight po natin lalo yung mga tao na nagkaroon ng problema sa droga and yet nakarecover. Ito po yung mga mas i-highlight natin. Huwag yung mga nalugmok sa droga at yung mga pangit na nangyari lang sa kanila. Yun lang ang i-highlight. I-highlight po natin lalo yung mga tao na nabigyan ng tulong agad and therefore nag-prevent na mag-worsen their situation or tinulungan at nakaka-recover at able to live healthy and productive lives again. Next, please. So let us break the chain of stigma of drug addiction. Next, please. And how do we do that? How do we actually prevent po before it happens? How do we prevent stigma on addiction? The possible ways to counteract self-blame and self-stigmatization will be to increase the knowledge. Tulad ng sabi ko kanina, educate about the causes and background of substance use problems. The everyday problems people experience are often the effect of a complicated sequence of events in their lives. Marami pong pinagdaanan yan. Kung malalaman nyo lang, kung makikipag-usap po kayo sa kanila, tulad po na nangyayari po sa akin, every time I have my clients, a person who use drugs, who's trying to seek treatment, kung mabalaman nyo lang po ang kanilang mga naging karanasan, naging problema, naging buhay, ay nako, kulang pa po ang maalaala mo kaya. Marami po dyan na pwede po kayong malalaman later kung anong pinagdaanan nila. Self-stigmatization is also an effect of having a stigmatizing attitude towards persons who use drugs. Yung pong stigma, self-stigma ng tao na nagkaroon ng problema sa droga ay also an effect of the social stigma. yung general population's reaction to people who use drugs. So dahil yon ang stereotype ng isang gumagamit o nakagamit ng droga, they have this self-stigma. So they look down upon themselves. The most important way to reduce stigma actually and discrimination is of course improved treatment and care for them. If there is an improved treatment and care for them, next slide please, it will be very helpful. The positive experience of a better community-based and integrative care of PWOODs is also very promising. Ngayon po, ang ating gobyerno ay in-enhance po ang community-based drug rehabilitation program. Nakasama po ang schools doon sa mga badak. Kasama po ang mga schools doon. When they are identified early, given treatment and given opportunities to develop and to live according to their functional and intellectual and social capacities, actually, yung quality of life improves enormously and they slowly become accepted and reintegrated in society in a much more humane way. Actually, meron pong mga ganyan, even in other countries wherein they give our recovering drug dependence source of livelihood, or they give them responsibilities in the community, and hindi nila ikinakahiya, and they become accepted. Bakit? Kasi nakikita nila na nag-i-improve na yung tao at positibo na ang binibigay nito sa komunidad, and therefore nagiging mas supportive ang mga tao, and therefore nag-i-improve din po ang kanilang pananaw tungkol sa mga persons who use drugs. Next slide, please. Testimonials. Actually, very important din po ito, yung mga testimonials ng mga recovering drug dependence or those who have recovered from drug dependence and trying to maintain it that way. Actually, yung iba po, nagkakaroon pa ng Speakers Bureau. Tinuturuan po yung mga PWOODs na ito ng mga recovering drug dependence on how to handle themselves in front of people and how to do their testimonials. Para po, it's important, it gave the speakers the assurance of their own value also. Binabalik po natin yung self-respect dito sa kanila dahil they are given the time to educate other people based on what? The things that they have in their past, how they were able to overcome the drug dependency or problem with drugs. Next slide, please. Ito po ang nakakalungkot. Sometimes interventions should be directed actually to the medical personnel giving the treatment for our persons who use drugs. They include addiction specialists, psychology, psychiatry, social workers, and other service providers who are often important sources of stigmatization. So very important na ito po na caregivers, nagpo-provide ng service, sana po sila yung mas maging conscious dun sa how they handle people and how they treat people who use drugs. Kasi minsan sila pa yung nariringgan mo, ay naku, kasi addict yan kaya ganyan. Ayun na naman, nag-a-addict ka na naman. Ang magulo lang ng konti, nakadroga ka na naman, So these things, wag na naririnig ng ibang tao. So, i-strengthen niyo po yung stigma for persons who use drugs. So, ganun din po sa inyo, mga educators. For learners to be listening to you and for them to be observing how you treat persons who use drugs, or students or learners who were apparently involved sa drugs, be very careful po because you might be agents of stigma for them. So there's also a need to change the curricula of medical schools and even sa mga grade schools, high schools, of other and schools of other allied professions to include the changing the presentation of a PWOOD and emphasize ways on what? To prevent and combat the stigma. Next slide, please. Actually, ito po sinasabi nila, they see the addiction, they don't see us eh. A survey of people who use drugs provided written reflections about what they wish people or society at large understood about addiction. Ito po ang sinabi nila. Iba sa mga ito ay sinabi, just because I was an addict, kung hindi porke ako'y naging addict, doesn't make me a bad person. Deep down inside, we are wonderful, loving people actually. Kaya lang kami naging victims of substance use. It's not a matter of willpower. Wala akong tao na ginusto na malulong sa droga. It's not that masama kaming tao. Hindi po namin ginusto yun. Addiction is not the entirety of me. I am me. I am not just my addiction. There is a lot of other stuff other stuff in me to love. I wish people saw the time that addicts spent alone. Akala nyo ba natutuwa kami sa ginagawa namin every time we lie to you, or every time na nangupit kami just to be able to buy illegal drugs? Hindi po kami tutuwa noon. Okay? Next slide, please. So, as an individual, ang tanong, how can you help? There are effective ways for individuals to help reduce stigma. And how? One is offering compassionate support. You display kindness to people in vulnerable situations that will prevent them. Sa mga taong alam nyo na nasa vulnerable situation, tao na kulang sa aruga, tao, estudyante na sobrang hirap ang pinagdadaanan sa buhay, please display kindness in them. Listen while withholding judgment. Seeing a person for who they are, not what drugs they use. Okay? Doing your research, learn about drug dependency, how it works. And of course, treat them with dignity and respect. Paano po silang maiengganyo na mag-change at magawa ng mga bagay upang mahinto ang kanilang pagkalulong kung wala naman pong nakikita na hope na iiba na po ang inyong pagtingin sa kanila? Avoid hurtful labels. Replace negative attitudes with evidence-based facts. And speak up when you see someone being mistreated. Huwag yung panunuorin nyo, tatawanan po at makikitawa kayo o makikijoin pa kayo. Huwag naman ganun. And of course, by sharing your own stories of stigma, you will be able to help reduce the stigma. Next slide, please. Actually, words matter. Yung mga words na addict, no, dirty, clean, junkie. Okay, I will tell you why. There are terms to avoid or terms to use, and why consider using these recommended terms to reduce stigma and negative bias when talking about addiction. Example, instead of using addict or user yan, o abuser yan, junkie yan, you may use person with substance use disorder, person who use drugs, person with opioid addiction, or merely patient. Because it's a disease eh. Why? Because person first language, tulad ng person who use drugs, the change shows that a person has a problem rather than is the problem. So pag sinabi niyong substance abuser yan, ibig sabihin siya yung problema. But if you say person who has substance use problem, ibig sabihin the person has a problem and therefore needs your help. The terms avoid illicit negative association, punitive attitudes, and individual blame. Also, don't use, instead of using alcoholic, person with alcohol use disorder or person who misuse alcohol. Instead of saying, former addict yan, reformed addict yan, you may say person in recovery or long-term recovery, person who previously used drugs. Madali lang naman po yun eh. Parating person first language ang gamitin. So sana po, after this, wala na pong gagamit ng addict ha. Addict yan eh. Ha? Person who use drugs. Person who has substance use problems. Also, instead of habit, you use substance use disorder or drug addiction. Because if habit inaccurately implies that a person is choosing to use the substance and can actually choose to stop. Alam niyo po, pag ang tao, person who has substance use disorder, kahit po alam nilang mali, hindi nila makontrol yung kanilang sarili to use drug because it gives them a sense of anxiety. It triggers anxiety in them hanggat hindi sila makagamit because it's a disease. It's a brain disease. So please, instead of using it's a habit, use substance use disorder. Or instead of the use of abuse, you say use or misuse for those misusing prescribed meds. Alam niyo po, meron po kasing nagkakaroon na ng mga tao na nagkakaroon ng problema with the misuse of prescribed drugs tulad ng morphine, di ba? Yung mga ginagamit para sa anesthesia or sa pain, no? Misuse prescribed meds po 'yon. Okay. And of course, the legitimate use of prescription medication is limited to their use as prescribed by the person to whom they are prescribed, and consumption is misuse. Kaya, misuse po instead of abuse. And of course, opioid substitution replacement therapy, if you have learned about it, instead of that, you use opioid agonist therapy or pharmacotherapy because it's a misconception that medications merely substitute one drug or one addiction for another. Mali naman po yun. Next slide, please. Using of clean, kunyari yung test results. Kunyari, nag-drug testing. Clean yan. Dirty yan. Please, instead of using clean or dirty, well, the testing was negative, result is negative, or result is positive. No, set an example with your own language when you treat patients who might use stigmatizing slang. Use of such terms may evoke negative and, of course, punitive implicit cognition. Next slide, please. And for those babies, no, kawawa naman yung ibang babies who are born to mother who use drugs while they are pregnant. So paglabas nila, nagkakaroon sila ng signs of withdrawal. Instead of saying naman, ay, addicted baby kasi si baby A. Huwag naman ganun. You just tell them, a baby A was born to mother who used drugs while pregnant. Baby A with signs of withdrawal. Okay. Babies cannot be born with addiction because addiction is a behavioral disorder. Are simply born manifesting a withdrawal syndrome. Next slide, please. So, ano bang advantage kung i-destigmatize natin ang addiction? If we shatter the stigma for addiction, it brings the disease into the light of hope. Binibigyan niyo po ng hope yung mga that-try mag-recover and healing. Diba? Imagine po nyo kung yung taong yon ay very close to your heart. Diba? You would want to give hope for them. You would want to encourage them to go for healing. So it's very important to destigmatize addiction. Now na. Wala nang shame. No more shame. Hashtag no more shame. It's time to break the stigma of addiction. Stigma is not just about hurting someone's feelings, ha? The stigma is about prejudice. It's about discrimination. And of course, violating a person's human rights. Sabi nga, don't judge me by my past. I don't live there anymore. I hope I was able to motivate you to stop stigma on addiction. Magandang hapon po sa inyong lahat.
Magandang hapon pa rin po sa inyo, Dr. Fuderanan. Maraming salamat po sa inyong i-share sa ating mga viewers ngayong hapon. We are receiving positive feedback. Salamat daw po sa inyong pag-share ng inyong expertise. And salamat po dun sa pag-shed ng light in this very, in a way, a sensitive issue. Growing up kasi, Doc, yun talaga yung parang ginagawang panakot, even the way that people who use drugs are portrayed in the media, lagi siyang nandun sa negative side. Are you saying, Doc, that it is inaccurate to use these labels on people who use drugs?
Yes, actually, we are kasi emphasizing on the negative. We should stop doing that. We should start emphasizing on what they can do after that stint in their lives. That there's still hope for them to recover. That there should be healing. Hindi porking nandun na sila, puro negative na lang ang dapat na maiportray sa kanila. Kaya yung self-esteem nila, lalo nating dinidiinan. Lalo natin silang binibigyan ng rason para mag-droga uli. So let's not be part of those people who would try to help them get back into the use of drugs.
Yeah. So,
alam niyo po, I'm sorry, no? Alam niyo po, hindi ko po sinasabi na dapat maganda portrayal natin sa isang gumagamit o nagkakaroon ng problema sa droga. Muli naman po yun. Maging makatotohanan naman po tayo. Kaya lang po, ang gusto ko pong sabihin dito is emphasize po na we would like to stigmatize the use of drugs, not the person. Okay? So we do not want to stigmatize the person. We want to stigmatize the use because if there is stigma on the use, there will be fear. Di ba? So if there is fear, what do? We avoid. And therefore, if we stigmatize the use, we avoid the use. And that's going to be very positive. But do not stigmatize the person.
Yeah. Doc, ang isa rin po, actually, ang nakakatuwa po sa nangyari ngayon sa session natin, we have plenty of time for questions from our participants. So if you have remaining questions, although very clear na yung presentation ni Doc Clara kanina, feel free to type them dun sa link na nakalagay sa atin. We did not have this plenty of time in the previous weeks kasi lagi po tayong nauubusan ng oras. But now, we have so much time to address your questions. Feel free to raise them.
Actually, I really made sure. Sorry. I'm sorry. Actually, I made sure to shorten, to shorten and be very concise with my lecture, so that we will have time for question and answer. So, yun po. So, please, if you have any questions or if you have any sharing, please do so. Because that will help. This is one way of educating and destigmatizing. If you can share anything, their experiences with somebody na na-stigmatize or hindi, then please share it with us because that will help.
Opo. Doc Clara, maganda po yung isa nyong shinare kanina na quote na actually different quotes from people who use drugs. And we have this tendency to really focus on the addiction. Tapos nakakalimutan ng i-focus yung person. What you have repeatedly emphasized throughout your talk is we should be careful not to box people into the labels we assign to them. Kasi they are people pa rin eh. They have stories. Yung sinasabi nyo po na minsan it's surprising for some people pag nalaman na they use drugs. So surprise sila kasi they have these mindsets nga na, oh, okay naman siya, pero nagda-drugs pala siya. I mean, kasi dahil nga po dun sa negative connotation, no? Dahil po ang marami sa viewers po natin ay mga teachers, and sometimes we have this attempt to prevent our young people from using drugs. ginagawang example yung mga gumagamit po ng drugs and they are put in a negative light. So Doc, you are saying na doing that reinforces the stigma, and that's something that we as educators in DepEd should rethink kung yun ba yung approach. So any suggestion?
Yes, thank you very much. Go ahead
So
po.
Doc, if I were a teacher, for example, what is the best way to talk about people who use drugs to my students?
Okay, the best way will be to emphasize the causes. What makes one, get involved with drugs? And then ipasok nyo doon yung preventive. So makikita nyo kapag mas maganda po for educators to present the problem on drug use or misuse by telling the learners about the causes. Ano yung causes? Ano yung mga preventive factors na pwedeng gawin para hindi mangyari at makamit yung cause na pwedeng magkaroon ng problema later. So it's the other way around. Kasi usually po, ang old school natin, even me, lalo na ako, na mas matanda ako kaysa sa inyo. So during my time, ang presentation ng isang may problema sa droga ay napaka-negatibo. Na tama lang na hindi sila gayahin. Pero ang tingin ko kung ngayon, ang aking pananaw, makikita ko kung ano, kaya pala ang pangit ng tangin ng mga tao sa isang gumagamit ng droga dahil bata pa lang sinasabi na itong tao pag naging droga ay papangit, hindi na makaka-recover, wala ng buhay, so huwag kang nag-involve. So parang pinatay na rin natin yung tao. So kumbaga parang wala nang pwedeng mangyaring maganda pa sa kanya kasi naka-label siya na isang may problema at pagkakalulong na droga. So ang best way is for education, for educators also to emphasize the causes and the preventive measures. Ano po yung mga factors na preventive? Ano po yung mga risky factors para po makita nila, ito pala yung risk. Ito pala yung prevent, para ma-prevent mo yung risk. Ang cause pala, ang isa sa causes pala nito ay yung hindi nabibigyan ng pakiramdam na pagmamahal ng magulang. So kung yun ang risk, anong preventive measure? Dapat pala ang mas magulang, sa bata pa lamang, maramdaman na ng bata na buo siya, na may nagmamahal sa kanya, and therefore, mahalin din niya ang sarili niya. So without even talking about substance use, you get that feeling that the learner should think about ano ang pe-prevent ko na mangyari, ano ang gagawin ko para mas maprebentan ko yung mangyari, para hindi ako makarating dun sa may problema na. At kung may problema na, dapat i-emphasize din po natin na meron pong pag-asa pang gumaling. Okay? Meron pa pong pag-asang gumaling at meron pa rin pong magagawa ang mga tao sa paligid niya upang mabigyan ng pag-asa na para po siya ay gumaling.
Ayan. Meron po ditong isang participant na nag-share kasi in-encourage niyo po sila to share their stories of stigma. Would you mind if I read this, Doc? Hindi na siguro natin papangalanan. Sabi niya po dito, alam ko
sandali lang. Ang importante po doon ay tanungin kung pwedeng i-share doon sa nag-type. Siguro sinabi niya dyan, baka gusto naman niyang i-share. So, i-share po natin without telling any names. Okay po.
Yes po. Opo. Sinasabi niya po dito na may sharing po ako about this kahit medyo personal. Gusto ko pong i-share kay Doktora. Nakalagay naman po sa form natin, Doc, that if they share, we will read this. And at least for this particular sharing, we are not mentioning the name. Sa una po, nung nalaman niya na meron siyang kapamilya na naging biktima ng droga, ang katotohanan po, napahiya ako kasi teacher ako. Pero bilang kapamilya, ako mismo ang nag-inform sa barangay para matulungan siya. And then before and every session for counseling, ako na nagsasabi na sa kanya na umattend. Sinuportahan ko siya at hindi ko na ikinahiya. Sabi ko nga po, andyan na yan, tanggapin na, tulungan. Natutuwa po ako sa discussion kanina at na-touch po ako. Salamat po sa inyo for sharing. May ganun kasi, Doc, no, na parang initial reaction. Teacher pa man din ako, ano na lang isasabihin. And those attitudes, those mindsets reinforce stigma. Doc? Ayan, so binasa ko lang po yung nag-share na isa nating...
Yeah. Uy, natutuwa naman po ako. Natutuwa po ako talaga dun sa nag-share kasi makikita niyo po, no, I'm sure naramdaman niyo rin po yung pakiramdam na sa unang initial na reaction, isang problema yan di ba? Normal pong reaction yun. Wag po kayong mag-guilty na naramdaman niyo yun kasi normal na reaction yun. Dahil nga, epekto na rin po yan ng ating kaalaman at ipinaniwala sa atin sa isang tao na nagkakaroon ng problema sa paggamit ng droga. So, epekto nun ay shame. Ikahiya natin. Pero congratulations po for being very strong at nanaig po yung inyong kagustuhan na matulungan siya. And I'm sure it has a very, very positive effect on the individual. Because naniniwala pa rin po kayo na meron pa siyang kagalingan. Another thing is, it emphasizes to the individual na merong pagmamahal at may mga taong nagkikare pa sa kanya despite of the things na he has done. Sabi nga, sinabi ko sa inyo kanila, I wish people saw the time that addicts spent alone, thinking about everything they have done, every time they have lied and stole. So, you see, nandun po sa kanila yon deep inside. Hindi lang nila sasabihin, but also deep inside when they see na yung mga tao sa paligid nila, despite of what they have done and despite the problem on substance abuse, ay paglalaban pa rin upang sila'y matulungan. Nako, napaka-positibo po at makakatulong yan sa kanilang recovery. 101% po. Salamat and thank you for being very courageous and sharing that and very generous. Maraming salamat po.
Yes, Doc. Natuwa po ako doon sa sinabi niyo doon sa nag-share sa atin na wag mag-guilty for feeling shame initially kasi we were brought up to think that way. Like, we grew up in a system na stigmatize talaga ang mga tao na gumagamit ng droga. So, our initial reaction would really be negative din. So, in a way, parang sinasabi niyo po na, sige, it's a process of unlearning, no? Na i-unlearn natin yung mga misconceptions, mislabels that we had. And then you proposed 3 ways kanina, Doc, on how we can do this. Tapos yung isa doon na sinabi nyo is protest. Maybe we cannot be physically joining protests, pero in our everyday conversations with our colleagues at work, in the classroom, in sessions like this, we have the opportunity to correct people. So in effect, that's in a way parang protesting. So how do you encourage us, Doc, to correct people who are maybe unaware as well na they are reinforcing the stigma on drug use?
Sabi ko nga kanina, you can go on. Yeah, sabi ko nga kanina, in a very nice way, wag humiliating way, wag yung shaming din sa kanya on how she reacts, but in a very kind manner na walang tao na makakarinig na mapapahiya siya na or in a jokingly manner, you can do that. Pwede po niyo yung sabihin like talaga ganun ang peg, Ganun lang. Tapos later, ikaw talaga, pwede mo naman sabihin ganito, di ba? Katawa ka talaga. Well, so when you say that, nakakatawa ka talaga, hindi mo siya pinapaya, hindi mo siya sinesermonan, pero magigets na yon, I'm sure. Kasi if you were in his place, pag gano'n ang approach, mas magiging receptive ka kaysa yung blaming or shaming na mali siya. Well, that will discourage him and become defensive. So, palagay ka ganun po. You can share in a positive way by jokingly, manner, kind, and of course, huwag yung mapapahiya siya.
It's really going to be a journey for all of us, Doc, no? And learning the things that we thought were true
Yes.
about drug use and people who use drugs. And then being gentle on each other then at the ultimate way is really necessarily about addiction. Marami pang mga positive feedback dito, Doc. Would you mind if I read some of them?
No.
Ayan. So,
No, it's alright. It's alright.
Sabi po dito ng isang birthday celebrant, teacher po natin.
Wow, happy birthday.
Miss Mary.
Happy birthday.
Sabi niya, today is my birthday, but
Happy
I can't
birthday.
miss today's episode. Ayan. Drugs addiction stigma is almost the same as the stigma caused to COVID-19 patients and survivors. But I really appreciate Dr. Clara's statement that persons should not be stigmatized, but the behavior itself. So it's not really to instill fear, but to prevent the initiation. We should be careful with our perception of people who use drugs and understand the causes that may have led to the addiction and identify means to prevent them. Give hope to those who experience stigma through education. Sabi naman po ng isa pa nating teacher from Don Leon Mercado High School, I really love the webinar today because it's concise and the pacing is just right. Thank you po sa ating napaka-competent na speakers. I think the 3 words that I would use to wrap up this episode are compassion, positivity, acceptance. They are powerful words that are significant in eliminating the use of social stigma. I used to live in a neighborhood, sabi niya dito na, sorry, I think I lost the comments. Pero sabi niya dito, sometimes ang mga words na aware ako na ginagamit regarding drug use ay labels like sabog, kalansay, and these are used to scare children. So would you agree that using such strategy or approach is a good method to protect children? Mukhang na-address naman na natin ito. It's unnecessary, no, Doc, to humiliate people who use drugs just to discourage children, but instead focus on the causes and then address them. Yan. Doc, meron na po isang question dito kasi on one side of the pendulum, we are talking about avoiding stigma, but someone is asking here, paano naman daw po kung mag-glamorize yung substance use on the other side of the pendulum? In effect, paano kung in avoiding stigma, nag-glamorize naman yung substance use?
Okay. This way we have to balance it. Sabi ko nga sa inyo, we try to stigmatize the use. Okay? We don't glamorize the use. We stigmatize the use. So, dapat mas dinan natin yung mga causes, effects ng use at hindi maganda niyang epekto sa katawan, sa isip ng tao, at sa kanyang relasyon. So, yun ang i-emphasize natin. We don't need to glamorize it. We just need to destigmatize the stigma on the person, but not on the use. So, use is hindi talaga maganda, and we should not encourage people from using, and do not glamorize na pag pala gumamit ka nito, social ka. Hindi ganon. Diba? We do not glamorize the use. We have to really stigmatize the use, but not the person.
Okay. So kumbaga, Doc, education pa rin, no? And that's what we always teach
Yeah.
naman our students, so that at the end of the day, they have informed choice. Na this is, if you choose this is what happens to you. And then we look at the causes, and we address those causes instead, without necessarily having to shame people or put people down.
Mhm.
Ayan.
Yes po, exactly.
Opo, meron po isang question dito, Doc. Paano po natin i-address yung mga may napapanood ang mga bata? For example, there are scenes where people who use drugs. What is the best way to talk to learners about this? How do we debrief? Yun po yung term na ginamit niya. How do we debrief students or learners when there's a scene from a movie that shows substance use?
Okay. I think if I understand it correctly, like for example, a scene of a substance of a person who used drugs, being involved in massacre or ganun po ba? So, tapos nakita nyo ang bata. So, una, be very careful with the things that you show your children. Okay? Always be there. Diba? Sabi ko nga, kaya nga merong parental guidance. Dapat po, parating yung ini-explain sa bata. And that is one way of injecting to your child kung ano ang kapangitan ng maggamit ng droga. Because it will have an impact on them that hindi pala talaga maganda ang magiging resulta kung magkakaroon ka ng paggamit ng droga. But explain to the child also, no, how that person came into that and what have been done to prevent it. Of course, kung consider nyo yung age ng child, kung paano i-explain. You don't need to go to the nitty-gritty part and detail of it, no, na hindi na maarok ng bata, makonfuse pa lalo. Every time you explain to your child, you try to see anong level of understanding niya. Just like when you explain what is sex in a child. So, wag yung ibang connotation on sex for you, iba naman sa bata. So, try to see anong level of understanding ang sa bata. Ganun din po dun sa understanding niya sa kanya nakita. And thank you for that. Tama po yun. Dapat, tinitignan niyo po kung ano yung nakikita ng bata at kung di maiwasan at nakita niya na, dapat ipapaliwanag niyo po kung anong nakita niya. And in order to prevent stigmatizing, then stigmatize the use, not the person. Again, ganun po. Thank you.
All right. Thank you very much, Dr. Fuderanan. Maraming salamat po sa pag-address sa mga questions. If only we can show you, and we will share with you the feedback that we are getting sa ating platform. Some are saying that they are enlightened, mas naiintindihan nila yung actual. There are really some of them who share personal stories that we cannot read here. Pero we'll let you know, Doc, how this lecture has been enlightening to many of our viewers. So again, maraming salamat po, Doc, and maraming salamat po sa ating mga viewers. Any closing words, Doc, for our viewers this afternoon?
Nakakatawa kayo talaga. Every time I'm involved with you in your program, natutuwa ako. Kasi advocacy ko naman kasi ito to be able to help, and nakakatawa rin kayo kasi you are very generous with sharing, nakakatawa, and then that's one way of trying to let out and educating other people who might be very shy in bringing up and letting out and sharing what happened to them. Pero by doing that, malalaman po ng ibang tao na nakaranas din nun na, oo, ako din naramdaman ko yan. Ay, oo, ganun pala dapat. So that's one way also of educating people by sharing what happened to you and how you reacted. And again, please, do not be too hard on yourself when at times you feel like, naku, pagkatapos nito, mali-mali naman pala ako kung paano kong ginawa ito sa aking mga kamag-anak. Mali-mali naman pala yung pagkaka-explain ko dito sa aking mga estudyante. Don't be too hard on yourself. Lahat po tayo nagkakamali. But, sana naman po itong pagkakataon na ito na nagkakwentuhan tayo will be able to motivate you to destigmatize addiction. And thank you very much for all of you. You've been wonderful. Maraming salamat. Sana po meron akong nagkaroon ng kaunting positibong pananaw tungkol sa destigmatizing of addiction. Marami pong salamat.
Maraming salamat po, Dr. Clara Fuderanan. On behalf of Dr. Dumlao and the rest of the School Division, we always appreciate the time na ibinibigay niyo po sa amin. We hope we could see you again after this pandemic soon.
Yeah,
sa mga
soon.
physical trainings in the future. Thank you very much po.
Yeah.
That's Dr. Fuderanan, our resource person for this afternoon, for this episode of our NDEP Webinar series. So what we got from today's session, I really like that part of the Q&A where Dr. Fuderanan comforted one of our viewers and said, "Huwag kang mag-guilty for thinking that way." And maybe that's the same mindset that we will take when we approach everyone else when it comes to this drug issue. We are always a product of our upbringing, of the systems that where we grew up with, and what we believe about drug use is usually a result of the things that we were taught about. Ito yung mga tinuro sa atin, napanood natin sa media, and slowly we adopted them. But I believe what Dr. Fuderanan is inviting us to do is to go back to our core and realize that just as we are persons who use drugs are the same persons. They are stories, they are people we can journey with, and stigma, the negative labels we assign to people who use drugs do not help. They even prevent people from seeking to understand the situation. Mas hindi siya nakakatulong, hindi siya may negative outcomes pa siya. So let's work hand in hand in destigmatizing our views of people who use drugs. Sa inyo na mga nanood ngayong hapon, maraming salamat. We take note of your feedbacks and we appreciate them. Ipaparating natin kay Dr. Fuderanan yung ibang mga sharing ninyo which you wanted her to know. And there are some questions maybe that could be answered mas personal na lang. So we are taking them note of them as well. Pero we would like to address again some of your questions related to the technical side of this webinar. So ang lagi po nating sinasabi, if you have questions about registration, you only need to go to this link that you will see on your screen. Ayan, baliktad. Ayan, so you will see on your screen bit.ly/2020 NDEP Web Series. And what we are saying is, kung meron po kayong mga questions about the registration, about link, nandyan po yan yung memo, mababasa po ninyo step by step. Pero let us just address again the frequently asked question about certificate. We apologize that we cannot just issue a certificate nang wala po kayong exit quiz. So when we go to the next slide, yan. So you have to go to the DepEd PDLMS and then take the exit quiz. Kailangan po ng exit quiz because that will be our only way to know that you really listened and you stayed during the broadcast. We want to have the quality pa rin po ng certificate that will be issued sa inyo and a proof that you really that you stayed with us all throughout the session. So the exit quiz is a requirement. May mga nagtatanong po kasi kung pwedeng bigyan ng certificate kahit walang exit quiz. We apologize, but this is a measure that we have set up para po makontrol din natin yung mabibigyan natin ng certificates. But we understand that some of you are having issues, so please feel free to explore the site kasi mas magagamit na po ito in the future in many trainings ng DepEd. So this is where we generate our certificates. So again, if you pass the exit quiz for each session, you get a certificate of attendance. And then kapag nakumpleto nyo po yung 10, you will have an eval form and a final exam toward the end, and you will be issued the certificate of completion. So yan po yung mga questions. I hope this clarifies. we are addressing ito pong mga bagay na to. But as we announced kanina, no, we just want to make a reminder na for next week, wala po muna tayong session, wala po tayong episode for next week. Dahil opening of classes and we listen to you, we understand the pressure po natin sa field and our preparations natin for the opening of classes. So we are suspending the episode for next week. Instead, you may use the rest of the week and the time next week para po sa inyong mga pag-review ng episodes, pag-take ng exit quiz, pag-generate ng certificate. It will be at the PDLMS. So again, wala po muna tayong broadcast, wala po muna tayong episode for next week. Let me just end this session again by thanking everyone who has been involved in this activity. Ito po from the start, from the preparations, katulad ng sinasabi ko po, iilan lang kaming nakikita ninyo sa screen, but behind this are people who have been working hand in hand to deliver you this NDEP webinar series. We are thankful to our partners from the Dangerous Drugs Board and the ASEAN Training Center for Preventive Drug Education na ating pong key partners in this NDEP webinar series. Inside DepEd, we are thankful for the support of our Information and Communications Technology Service who are the staff behind the platform na ginagamit po natin to make this possible. For Director Abram Abanil, kay Sir Mark C., kay Sir Mark Anthony Papa, and thank you rin po sa ating Public Affairs Service, Director Godoy, kay Johnson and his team sa mga pine-prepare po nila for our na mga materials to promote this activity. We are thankful for the Youth Formation Division, the DepEd regional offices for disseminating the information about this and mobilizing our participants and providing technical support where needed, as well as with our school health and nutrition personnel, our BKD coordinators, our NDEP coordinators. Dito po sa central office, we have the School Health Division, meron po tayong secretariat, we have Michelle, Ma'am Shirley, preparing yung mga papers and other back-end work for this activity. Maraming salamat. And of course, sa inyo pong lahat who faithfully follow us every 4 p.m. of Tuesday. So magre-rest po muna tayo for next week and we will see you again on October 13, 2020. That's still Tuesday, second Tuesday of October para po sa ating next episode. I hope kanina we started with you thinking about a person who uses drugs. Now, we end with that as well. If you complete that sentence, ano na po yung nabubuong statement in your mind when you complete the statement? A person who uses drugs, blank. Sana po nag-create ng kaunting pag-iisip, ng kaunting pagbabago sa inyong mga mindset. Ito pong naging session natin ngayong gabi. So again, maraming salamat po. We'll see you again on October 13.